It takes a huge amount of courage to come out, particularly if you're a young person, and a level of self-confidence. But it also requires a certain confidence in the systems, in the society, in the culture, in the family, in the peer group in which we are coming out.
Hello and welcome to another episode of the HSE Talking Health and Wellbeing podcast. My name is Fergal Fox, and today we are speaking with Dr. Matt Kennedy, Research and Advocacy Manager with Belong To, and Denise Croke, HSE Health Promotion Officer based in Naas. To you, the listeners, thanks for supporting the podcast, and please give us a follow wherever you are listening to this episode and share with a friend or colleague who you think might benefit. So today we're going to be talking about being LGBTQI+ in Ireland on the back of a research report published earlier this year. Sadly, this report highlights an extremely challenging reality for LGBTQI+ people in Ireland, and we will be talking about mental health and with some mentions of suicide and self-harm. It's important for listeners to remember that emotional support is always available 24 hours every day from Samaritans on the free phone number 116123, and from Text About It, text HELLO to 50808, and supports and services from LGBTQI+ support organisations such as Belong To, who we're talking with today, at belongto.org, LGBT Ireland at lgbt.ie, and Transgender Equality Network Ireland at tenny.ie, or visit the HSE website yourmentalhealth.ie for more information on mental health supports and services. Okay, so I really want to welcome Dr. Matt Kennedy and Denise Croke here today. You're very welcome to the podcast.
Thanks, Fergal.
So Matt, you've been working with Belong To for how long?
This is my 6th year working with the organisation.
Tell us a little bit about Belong To.
Belong To is Ireland's national LGBTQ+ youth organisation. We provide supports and services directly to LGBTQ+ young people through our youth groups and the various other kind of projects and programmes that we do. Like we have a partnership with Pieta where we provide crisis counselling. Our youth workers do one-to-ones, but we also support caregivers and professionals as well through our education and training work. And we work with a number of different other organisations and state agencies as well through our advocacy work and our research, which would be a large part of my responsibility.
Okay, and we might come back to that work later on. And Denise, I know that you've been working as a long-time advocate and champion for LGBTQI+ health and wellbeing with your work in Kildare, Older Voices in the past, and your current work in the HSE and as a volunteer at many groups, including Belong To. You've been working in this space for a long time.
Yeah, I come from a background of community development and I'm in the HSE 3 years now. So just continuing that work of trying to foster environments of inclusion within the HSE.
Yeah, that's the theme that was kind of jumping out through the recommendations as well, that we need to foster more environments of inclusion. I suppose that's the sense in which we're doing this podcast today. So the research report that we're talking about today, being LGBTQI+ in Ireland, was produced in May of this year. Trinity were the lead researchers on the programme. But in terms of funding, our partners in the HSE, the National Office for Suicide Prevention, HSE Social Inclusion Office, they were involved in funding and supporting the work. But before we kind of get into it, let's make it very clear what we're talking about when we use the terminology LGBTQI+. Matt, over to you.
Thank you. Yeah, so the research report uses the acronym of LGBTQI+, and that stands for lesbian, gay, bisexual, transgender, queer, intersex, and then the plus is to kind of reflect some of the other marginalised and minoritized identities within the community, both in terms of sexuality and gender identity. So at the core of the research report, it's really interested in terms of like how does having a minoritized and marginalised sexuality or gender identity potentially impact your mental health and well-being? And in the round, you know, if I was to give one line about what the research really finds, it's that it does. It has a really significant impact in terms of what your mental health and well-being will be.
Absolutely. The hub of what we want to discuss are the research findings, and they're very stark in relation to suicide and mental health. I just want to highlight some of the statistics. I've said they're very stark. In relation to 14 to 18-year-olds, 72% had self-harmed, 77% reported suicidal thoughts, and 33% had made a suicidal attempt. And those figures for 19 to 25-year-olds are fairly similar as well. Can you go through some of the key findings with us, Matt?
Yeah, I can, of course. And I suppose even just to kind of set up some context for people listening, being LGBT in Ireland is a repeat of the LGBT Ireland study that was done in 2016, which was kind of one of the first really large quantitative pieces of research that was specifically looking at the community's mental health and well-being. And I think that the fact that it wasn't until 2016 that was done, that we had a kind of a clearer picture about the community's mental health and well-being is quite important. And I love telling people that actually the data from that LGBT Ireland study was collected prior to marriage equality. There's a really rich opportunity in being LGBT in Ireland for comparison in terms of like what has changed for the community since like the introduction of marriage equality and gender recognition and the various different strategies that are particular to the communities. I suppose like social inclusion as well as their mental health and well-being.
It's important to put that into context in terms of the journey that we're on in Irish society.
Yes.
And my kind of reflection on the 2015 referendum, or things were changing, or that was a signifier of change. But you're saying that the 2016 data was carried out before that?
Yeah,
okay.
Yeah. So data collection was done, prior to the referendum. So it's really, there's a really rich opportunity there for actually exploring like what did those kind of changes in Irish society through legislation and policy, like what material impact did they have on people's lives?
And there was two parts to this study.
It mirrored that LGBT Ireland study in that there was kind of two modules. So there was the first one, which is the kind of broader community survey. It's full of a wide variety of blocks that are looking at, like you mentioned, self-harm, mental health, suicide ideation, self-esteem, but it's also looking at healthcare access and school experiences. And it captures a really rich amount of demographics of the community as well. And then the second part is the public attitudes piece. So that was done kind of with the general public. And it had kind of a two-part in that it was an online survey and then it was also a telephone survey. The research team did a really amazing job at being able to put like the context of public attitudes in conversation with some of the experiences of the community. So if you're seeing that there is a lack of understanding, particularly among certain sexualities or gender identities, of course, that's then going to impact how included people feel in their communities or in school or in their workplaces.
What jumped out at me, 2,800 people in Ireland, with LGBTQI representation. That's a very strong cohort. And then you put on top of that then was the public online survey and public conversations with the phone. It's a very comprehensive piece of work.
The survey in and of itself, it was huge. And we did a lot of work, and we're particularly conscious of there is kind of survey fatigue among a wide variety of populations, including the LGBT community. So we had concerns like, will people actually fill it out? It's quite long, potentially triggering content within it. So we had a lot of safeguards built into it so that people could feel safe as they were making their way through it. But I think it really stands to the fact that the community wants their voice heard, that we had such a wide engagement and we had such a spread of ages and different sexualities and gender identities. And I suppose similar to LGBT Ireland in 2016, that study, there is a substantial, I suppose, cohort of the sample who are kind of in that youth demographic, that kind of 14 to 25.
Some of the findings for that group were the most stark. I don't want to layer the concern here, but there's concerning findings across the board here. But in terms of LGBTQI youth, it jumps out as like, really, really alarming statistics.
Yeah, absolutely. And I think that was one of the kind of key findings for us, and it kind of emerged pretty quickly as the research team started the analysis, was that the community overall is experiencing various degrees of kind of vulnerability in terms of their mental health and well-being, but LGBTQI plus young people and the trans community are particularly at risk, particularly in terms of that kind of, depression, anxiety and stress, self-harm and suicide ideation. So that gave us quite a significant steer in terms of what the recommendations should look like and where there's meaningful areas particular to those communities that we can focus on.
What was your own reflection on the findings, Denise?
The youth piece is very interesting, and it strikes me that we've kind of almost gone from one extreme to another, in the sense that people of my generation at that age of life and realising my sexual orientation was different, there was no representation, there was no visibility. I had no role models. I never saw the life that I intended to create for myself represented anywhere. And that created potentially negative mental health issues. But now there's a greater visibility, a greater openness. And that in itself is nearly a detriment, again, because you have people commenting on social media, and young people in particular are very exposed to social media. And you have all this vitriol and hate speech, to call a spade a spade. People are either commenting on the life that you are claiming for yourself or the identity you're trying to create for yourself, or you're witnessing it being spoken about, people you care about, people you love. And it's a very difficult space for young people to be in, I think, for any of us, but particularly if you're at a young, vulnerable age and you're trying to deal with creating your own identity. And particularly then if your identity is one that isn't a mainstream identity.
Yeah, I'm conscious this is such a sensitive subject. But, you're touching on some very important points there, Denise. not seeing who you think you are.
Yeah.
No representation. In looking at some of the findings in the study, there's people saying that they were concerned about their parents, they're concerned about confidentiality in schools. That coming out is still a really, really difficult thing to do.
Yeah,
and sometimes the increased representation on some media is a negative thing. That's very hard.
Yeah.
It's very hard to
Because
take.
in either scenario, the message that you're getting is that who you are is not okay. And that's a terrible thing to carry as any human, never mind a young person just starting off in the world, looking to build relationships and friendships and find their community and find a place of belonging.
Yeah. And you mentioned the age range of the people that replied to the study and engaged. 14 was one of the most common times that people would be kind of considering coming out.
Yeah, in the key findings report, people kind of see there's a really interesting timeline just in terms of young people's ages that maps directly to kind of like when they're in school, when they're going through kind of self-discovery, when they're kind of figuring out who they want to be in the world. And yeah, 14 is the age that they're the most likely to kind of come out to people. It's also the age that trans young people are most likely to start living as their gender identity. But then we have 12 as the most kind of common age of realization of their kind of sexuality or their gender identity. What's significant is that that's both of those kind of points in time for young people have now gotten younger since 2016. And that to us, like from an organizational perspective, is wonderful. Kind of shortens the gap in the period of time in which young people feel like they have to hide and which they are kind of struggling with their identity. But what is quite challenging about that finding is that while, 14 is the point of coming out for young people, we're still seeing that coincides with the most common age to start experiencing self-harm and suicide ideation. And for some young people, it can also kind of coincide with the first suicide attempt. And that can seem kind of at odds with what is being said in terms of like, surely it's a really meaningful moment if someone feels as though they can come out. But actually what that's kind of telling us in the context of the rest of the findings is that for many young people, while they might be going through meaningful self-reflection and understanding, potentially the spaces then in which they're coming out into aren't completely accepting of them. Going into Denise's point, like maybe they're coming out and all of a sudden they're seeing, anti-LGBT sentiment online. Potentially they're experiencing bullying in school. Like you mentioned, Fergal, like maybe their family isn't accepting. So that then can kind of compound that vulnerability at what is already, a vulnerable point in time in terms of coming out to people. So it's kind of to alert people to the fact that coming out is never easy, even, despite the really meaningful social progress that we've made.
Teenage years are never easy.
No, for anybody. Yeah,
but then,
absolutely.
But then go ahead there.
Yeah, but just that there's an increased level of vulnerability for young people and that it does still need to be handled delicately by the caregivers and the professionals who potentially are in LGBT young people's lives.
Yeah, and I think that, it's important to reflect that coming out is a process, that you don't just do it once. In many ways, you do it in every new situation and in every new work setting, in every new school, in every new peer group potentially. And I remember years ago, and Pat Carey, the politician, came out as a much older man, and he spoke about having courage and confidence. And it always stuck with me because it takes a huge amount of courage to come out, particularly if you're a young person, and a level of self-confidence. But it also requires a certain confidence in the systems, in the society, in the culture, in the family, in the peer group in which we are coming out. And sometimes that confidence is justified and sometimes, unfortunately, it isn't. And I think our responsibility as adults, as human beings, is to create the conditions in which that confidence is justified. And it isn't just the responsibility of the LGBTQI plus community. Inclusion is everybody's business. As a minority group, we cannot create the conditions of change for ourselves, by ourselves. It took a majority vote to get marriage equality. We're not that majority. So the role of allies, the role of aware, sensitive caregivers, communities, friends is hugely important.
Yeah, supportive environments you're talking about.
Absolutely,
and that can be the home, the community, the workplace, the school. The school seems to be, have huge potential for harm and good. And I suppose the workplace as well. You're spending a lot of time outside of the home in these settings as a norm. I just want to highlight some of the quotes from the research report, and one here from a 26-year-old non-binary queer and bisexual person. Turning our identities, especially the trans community, into a topic for debate has made hate a legitimate, respectable viewpoint. It's giving a free pass for prejudice and hate speech and giving hateful people a platform. That's very powerful. Another quote I'd like to highlight from a 36-year-old gay man. I felt it would have been easier to take my own life than actually be the person I was. I was so scared of being me, I thought it would have been easier to be dead. That way all the suffering would end. So I think both those quotes highlight some of the issues we're talking about today. So you're dealing with a community in crisis and inner turmoil, and the quotes that you have included from the interviews really capture the struggle that's going on around this issue. And I think they're very important. What's your own reflection on what participants shared through their interviews with the researchers?
I suppose just to clarify that the quotes were all from kind of open text box qualitative pieces within the survey. So the research team didn't interview anybody, just to flag that. But people gave reams and reams of their own experience into that, like really long paragraphs, like really detailing their lived experience, which I completely agree, because like I would be a qualitative researcher first and foremostly. So I think that it just adds a different kind of texture to the statistics, and it kind of serves to remind us that they're not just numbers, like there's a person behind every single one of those statistics. And I think that they kind of hammer home a lot of the, the vulnerability that young people are definitely facing, but also that like different, I suppose, cohorts in the community. I definitely was particularly mindful of like, people in rural parts of Ireland where like the same level of social infrastructure and support potentially isn't as robust as it is in Dublin, and the importance of kind of making sure that those communities also have access to the same level of support that people in, cities and larger towns do. Something that I found quite significant as well as we're thinking about young people, Denise, what you were saying about across time and kind of seeing yourself be more visible, is that we did see that older participants within the study reported higher levels of kind of, mental health and well-being, like it improved across time for them. And they had greater senses of self-esteem and resilience. And some of that, a lot of them were putting it down to, as you get older, you tend to develop a bit of a thicker skin. But also there was a sense that like they were witnesses to a changing Ireland, and that they were able to then kind of foster this greater sense of, I do belong in my community. Actually, there is a place for me in my job, and I can bring my full self to these environments. So I think it's significant for us to try and be able to do that for young people in the here and now, so that they don't have to wait until they're older to be able to experience what it's like to be your full authentic self in community with people.
Like there's a sense of being battle hardened, and there's no need for the battle. And the battle is full on at the moment. Yeah,
absolutely. And something that I've been saying around this research, particularly around like LGBTQI plus young people, but specifically trans young people. I came out as trans when I was 19, almost 10 years ago now. And I actually think that it's harder for trans young people to come out now than it was for me 10 years ago. I think it's a very different environment for them to kind of be coming out into, in part because it's kind of a double-edged sword in that more people are aware of what it means to be trans now. So there is opportunities for some people to have that level of understanding, be able to support those young people. But sometimes there can be a lack of that meaningful education around the material supports that trans young people need. And also they're listening to quite a significant amount of vitriol within, unfortunately, it's sometimes national media, but also kind of more generally in global media. And we really saw that in the report, in that when it comes to, Denise, as you were saying, in terms of that hate speech online, it was young people in the trans community who were the most affected by both experiencing that and listening to it.
Do you think that's a lack of understanding, Matt? Trans and intersex would be the least spoken about or the least developed in our cultural understanding, in my experience anyway. Do you think that's part of the...
Yeah, no, absolutely. And I think that that's a really significant point in terms of the public attitudes piece that the research team kind of did a cross analysis in terms of like people who knew a trans or intersex person were much more likely to have positive attitudes because they understood what that lived experience was. They had, a colleague or a friend or a family member. And that, to me makes a very clear link in terms of when you have a sense of awareness about what that identity means, you're much more likely to be inclusive, to be understanding. It's less discussed, I think, gender identity in the round, that people don't have the same level of awareness around maybe lesbian, gay and bisexual identities.
And I think people are afraid as well, and when I say afraid, I mean afraid of causing hurt. Particularly in the, I work with a lot of healthcare workers, and I'm involved in an initiative called the Rainbow Badge Initiative, and it's around education and awareness, leading to a visible symbol of the rainbow badge, which supports people to disclose their sexual orientation or gender identity if they wish to a healthcare worker or professional who would be resourced to signpost, to refer, to support, to just have an appropriate, a sensitive and a compassionate conversation. The biggest challenge that comes up for people is around terminology and almost not wanting to say anything for fear of saying the wrong thing, particularly in that trans or intersex space. It's, how do I ask? Will someone be offended? How do I get over those things to engage with the person, you know?
Definitely is a sensitive subject.
Yeah, no, I was just going to say, like, we experience that all the time working with professionals, including healthcare professionals and teachers as well. My advice to them would always be, like, if you're coming into any sort of interaction with, be it an LGBT young person or adult, like, if you're coming from a place of care and compassion, people can sense that immediately. It's so clear in the findings that one of the most significant positive protective factors for the community, particularly around the mental health piece, but just in healthcare in the round, was being able to go in and have a positive interaction with a professional. And that didn't ever, especially in the qualitative stuff, it wasn't, oh, they knew everything. It was that they saw me for who I was. I felt I could be open and honest. They asked meaningful questions and I got the care that I needed. And I think that the Rainbow Badge is so reflective of that, trying to move towards empowering professionals to be able to do that without kind of that fear that 100% I know is there, and I can appreciate why. Yeah.
Just to create the safety net of a dialogue where you can say to people, I don't have all the answers. No one is ever going to have all of the answers because it's human sexuality. It's evolving. It's developing. It's never going to be definitive. As long as we're alive, we'll be changing, evolving. We'll be learning more about ourselves. We'll be finding new ways to express ourselves, to be. And that's all okay.
Yeah, absolutely. And I always, particularly with teachers, I like to kind of remind them, like when I'm in the youth groups with young people, like sometimes they'll use, you know, terms that I've never encountered. And I'm a professional who works in this space day in, day out. And like, I think that's really exciting to just kind of be like, oh, I've actually never heard of that. Can you tell me a little bit more about that? And actually, you know, that never backfires because it's coming from a place of genuine curiosity and wanting to understand someone further.
That's powerful work. I absolutely agree with you, Denise. I've experienced that fear myself. Like, okay, I'm having a conversation here. How do I navigate this? And I found the HSE land training useful for my own terminology and frame of reference because I'm not working in that in a youth setting or I'm not working with the public. I feel like every few years I have to check in with that because it's not, you know, I'm not using it on a daily basis. And I don't see it reflected in public discourse. What I see, maybe it's online, it's a lot of, you know, this is where I sit, I'm against this. And this is where I sit, I'm open to this. It's too left and right. And that gives me huge concern when I read this study about young people navigating that path and seeing the left and the right a bit too starkly. You know, that's a concern.
But I think people who would be in the nuanced middle in that scenario are the people like we're speaking about who are so afraid of hurting someone that they, you know, that they don't engage.
No, it's very, very important. You know, and I just want to go back to your point, Matt, there about working with teachers. You know, that if they're open to kind of spill the beans on what they know, this is my base level of knowledge, help me improve it. But surely you must get great reward about engaging with teachers around this work.
Yeah, I mean, they're incredible. Like we have a really brilliant education and training team who've been, you know, doing this work for a number of years around our stand-up awareness campaign, which is our anti-homophobia, biphobia and transphobia awareness week that happens every November. And in the past couple of years, we've been working on kind of a quality mark, and there's a specific recommendation around a national rollout of that came directly from the research team, because what we've seen is that, you know, having one-off kind of training sessions with teachers is wonderful and can do a lot of work kind of in the interim, but really to kind of shift a school climate, to shift that kind of, you know, socio-cultural environment in which young people are, you need to be engaging the curriculum, you need to be engaging policy and practice. You have to have, you know, caregivers involved, and you have to have the board of management on board as well. It really is about that kind of whole school community approach. And what's really wonderful, and you see this in international research as well, is that when you have those really integrated, inclusive kind of campaigns and programs like the Quality Mark, the benefit is not just for LGBT young people, it's for the whole school community in the round, because you foster a greater sense of, oh, we can have these conversations about difference and the importance of difference in our society. And it doesn't have to be challenging or hostile. It can actually be really rich and meaningful in terms of caring about your peers and understanding them on a deeper level.
So you're working in the school environment, you think you're doing it for the kids, but you don't know people in the community could see that, or people in the teaching staff.
100%.
And just blow your mind. People are like listening to some of the quotes or looking at some of the quotes from the study. Like people are hiding in plain sight because they don't need to be wearing a rainbow cloak every day.
Exactly.
You know, what you're talking about there, that inclusive environment. I'm just reminded of Moira Germain in our own sexual health and crisis pregnancy program. She's the education lead there, because she came on a podcast, episode 9, around the Making the Big Talk, many small talks, resources that we've developed for parents. And those resources are on our sexualwellbeing.ie website, but they're to help parents and children have conversations. And they aim to be inclusive of all gender identities and sexual orientations. We need to kind of integrate that thinking in all our work. And I know that there's recent announcement around the SPHE work at senior cycle, and we're working with the Department of Education and the NCCA on RC resources for junior and senior cycle, and the school, like that's getting into the curriculum. That's changing the game, changing fundamentals, you know, and I know there's going to be a lead in time for training teachers, but that cultural shift or that journey that we spoke about, we're very much in the height of it now, aren't we?
Yeah, absolutely.
In terms of community as an inclusive environment, I want to go back to the Rainbow Badge work you mentioned, Denise. You're trying to support health service as a community. Do you want to tell me a bit more about that work? And I know you've been part on a recent conference. It's the third version of trying to get the issue highlighted.
Yeah, so the Rainbow Badge initiative came over from the NHS in the late 90s by Mike Healy in Lindara and CAMS and Matt Swain. And they initially were looking at it as a way to encourage and support their children and young people to come out in a safe space. And a small group of us in Dublin, South Kildare, West Wicklow came together at the end of 2022 and decided there was a space to implement it for adults and older people across the service, thinking that it would be primarily for service users. But like all these things, you start off with one target audience, and a bit like you were saying, then we started having requests for support from colleagues, and it made the safe space for colleagues to say, well, actually, I wish this was around in my day, or it's great to have something like this because I come into work every day and I change the pronoun of the person I've spent the weekend with. And I just thought that was very sad, and it kind of drove me and my two colleagues in the work. And basically it's a symbol, but it's not an empty symbol. It carries a huge responsibility in the sense that by wearing a badge, you are saying to someone, it's okay to talk to me. And we would be very much of the mindset, don't create the impression that it's okay to talk to you about something so important if it genuinely isn't. So if you're not a safe ally, don't be an ally at all, would be our thinking. And initially we started off with the educational modules on HSE land that you referenced, Fergal. So the LGBT plus inclusion, the basics and transgender issues in healthcare as a minimum standard for wearing the Rainbow Badge. Recently, we've evolved that to have a face-to-face training or workshop aspect to it, because if you are struggling with terminology, like we said, you can't have that dialogue with an online module. You can't say, hang on, I don't really understand that. Can you just explain that a bit to me? We do face-to-face. We've also done a workshop in a multicultural setting. We had somebody from an African country, a healthcare worker, come in, and we did a bit at the beginning about what do you hope to get from this workshop. You know, I nearly couldn't do the workshop. I was that blown away by it. She said, everything I've learned my whole life has been to hate you.
Oh my God.
And I want to learn different now.
Wow.
So
the courage in that, you know, and we all need to continually challenge our own biases, look at our own perceptions, but it takes courage to do that. And it takes a level of awareness that I think is very special. Moments like that kind of motivate us to broaden it and to make it better and improve it all the time. But also a recognition that inclusion is everybody's business. So it isn't just about the working group for the Rainbow Badge. We're very lucky. We have a very supportive head of service, very supportive general manager, and anything we've asked for has been pushing an open door. So we've had LGBT Ireland come and do awareness training with our workplace wellness committees, so that when initiatives, when programs for staff that encourage workplace wellness are being decided around the committee table, that inclusion lens is always there, that it isn't just a by the way. And then looking at our community delivery partners, so we're looking in towards the end of this year developing a community-based model for implementation in our Sláinte Care Healthy communities with our delivery partners. Because inclusion is a determinant of health as a health service, I think where we have the opportunity to embed it as much as possible, we should. And then creating the conditions where our delivery partners are coming from the same set of core values that we are is hugely important.
So again, really, we're getting back to the importance of allies, the importance of training, the importance of supportive environments. And every listener can be a supportive ally. And if you're working in the HSE, there's training there, there's supports out there, and use the likes of the resources on the Belong To website and other partners that I mentioned here. You mentioned kind of an urban-rural divide or concern that people would feel plugged in or supported adequately. Mm-hmm. So you're working with youth organisations or you're working with young people directly? Which way do you...
We work with a national network of LGBTQ plus youth services throughout the country, and they do really fantastic work, throughout rural parts of Ireland as well. That was a really significant finding in terms of what young people in particular felt had a positive impact on their mental health. So it was access to LGBT specific youth services, or also as well like feeling that mainstream youth services, even if they didn't have like an LGBT specific group, but that they were safe and they could go there and they could kind of bring their full selves. And that was also kind of reflected for, adult populations in the survey as well, like having access to LGBTQ plus supports and services. So to that kind of point, it's definitely important for us to kind of see that reflected throughout different parts of Ireland, not just in Dublin, where it does, tend to kind of be localised. In the same way for other marginalised communities, a lot of the support tends to be localised in Dublin. But some of the other, I suppose, like community-based forms of support was being able to come out in your workplace was a really positive protective factor for people. Being able to, of course, come out to their interpersonal circles. So being able to come out to friends, come out to family and having positive reactions. And then, other somewhat surprising kind of ones like feeling in touch with your community through belonging in like a sports club or having, meaningful hobbies that kind of connected you with other people. Not just LGBT people, but just like allies in that sense, where similar to your kind of point, Denise, like where people didn't have to hide away, that they could kind of bring their full selves there. And crucially, I think, as we're thinking about that kind of comparison between, this report and 2016, people definitively said that things like marriage equality and the introduction of gender recognition for the trans community to be recognised as their gender in law had positive, was really, really positive impacts on people's mental health and their sense of themselves in the country as well. So I think that's hugely positive for us to kind of hold on to the meaningful social progress that we've made, because I think around the hate speech piece in particular in the report, what came out of the kind of qualitative findings around that was that people were really worried that there would be this kind of growth of hate in Irish society that might impact the social progress, might create a kind of a rollback of the social progress that we've had the benefit of experiencing in Ireland, because we have seen that happen internationally. So there was a real sense from the participants in the research that what Ireland has done, what the government has managed to do in the past couple of years is hugely meaningful. It's not empty. It has meaningful and material impact on people's sense of themselves and social inclusion, but they need to be safeguarded.
Yeah, I think that backs up the call out that I just made a minute ago about, getting behind this movement and supporting the work and seeing yourself in some way as a supporter and ally. Because if you're not, if you might be part of the issue here, that you're blind to this or you don't see the importance of it. I saw a fantastic tweet that went viral at the weekend. Somebody saying they came out to their dad and they just had the cutout of the WhatsApp message. Said, "Hey Dad, I'm trans. This is my new name. I've been out with my family for 2 years." And the father's response was, "There's pizza here if you want some." And it was just, the father didn't have any language, but he was just like, this is, and somebody had it shared it as like, this is the most Irish
dad way to
it was a beautiful little thing, and it was beautiful to see that it had gone viral as well. Part of that positive messaging that's going on there. I really appreciate your participation in the podcast today. I'd like to thank Dr. Matt Kennedy and Denise Croke for joining me today to talk about this very important subject. And I'd like to give you these important signposts for you to get more information. The Trinity website, the belong2.org website has the research report. It has excellent recommendations. Please take some time to have a look through them. I'd also like to give you the signpost back to the HSE website. There's a toolkit there on how to implement the Rainbow Badge. We'd love to get more support for that in the HSE. Another thing I'd like to highlight is that the HSE has a number of employee resource groups operating under the Diversity Hub, and the Reach Out network is the group for LGBTQI plus staff and allies. This network can be contacted through the Diversity Hub, and new members are always welcome. The support organisations I called out in the introduction around mental health and suicide, self-harm, those supportive organisations, we'll put all the links to those in the information section of the podcast here. So wherever you're listening to it, you'll have the links there. And finally, I just want to thank you for your support of the podcast and for tuning in today. appreciate your support.